Being born at 23 weeks and 5 days, she was 1 pound 4 ounces. Her eyes were still shut. Her fingers and toes still had webbing on them. We found out that she's going to need heart surgery. And in Sioux Falls, there was no pediatric cardiologist. One of the neonatologists in Sioux Falls pulled me aside, and he told me that children's was the best there is. And if Shelby were his daughter or granddaughter, she would have already been there by now.
Children's Hospital was opened in 1924 to offer hope to children in need and their families. Today, Children's Hospitals and Clinics of Minnesota has become one of the premier children's hospitals in the country, serving families from every county in Minnesota and many surrounding states.
This is a freestanding children's hospital. Every single thing was made for children. And if they're tiny, we have very tiny instruments. And if they're big, we have big instruments.
Over time, Children's has evolved into a nationally recognized, unparalleled healing environment. We treat over 120,000 patients every year. As a Level 1 pediatric trauma center, we offer access to pediatric specialists 24/7, so at no time is any child without access to those who know them best. Children's is also the leading provider of medical education for pediatric primary and specialty care, training more than 350 residents and fellows each year. After establishing our medical home in 2004, we continued to transform the way care is delivered. As an HCDS partner with the state, we coordinate care for 15,000 of our patients. The emphasis on care coordination models is also vital in our new Neuroscience Center in St. Paul and the unique Mother-Baby Center partnership with Alina. All this and more help us treat even the tiniest child with incomparable care.
This was going to be a lifelong battle for her. I just wanted to make sure that she had all the tools given to survive, and if she couldn't make it, that was between her and God to decide.
Our primary goal is to make sure that we understand what a family needs, not just what medicines or what procedures or what lab tests.
At Children's, we treat the whole family through the comfort of all private rooms, the first inside the hospital Ronald McDonald House, financial and support services through our Family Resource Center, and interactive sibling play areas.
Children's promise to the families is to provide outstanding, excellent care, regardless of the ability to pay.
That's a commitment that Children's has made because we believe that it's the best thing for families.
We are keeping that commitment through innovation and ingenuity, always finding new and better ways to provide the best care.
The music therapy, the pet therapy, the child life, every child gets these services, or it's available to them.
Nowhere does that appear on a bill, but that's a critical part of making sure that that child heals as quickly and efficiently as they possibly can.
There's a large number of children, more than 42% are actually covered by Medicaid. This number dramatically went up over the last few years.
Medicaid and, mainly Minnesota Medical Assistance has been, basically a financial safety net for us.
She was in the hospital for a total of 6.5 months in the NICU before we were able to bring her home.
The thing that medical assistance has helped us with is the private nursing, which is a requirement with having a tracheostomy. It's still a single-income household. Suzanne can't work just because of the fact that the amount of appointments and therapies and stuff that Shelby has to go to, with, her condition, doesn't allow us to have a 2-income household.
For every dollar of care we provide, Medicaid pays 80 cents. In essence, we cover the cost of 1 out of every 5 kids we see on Medicaid.
The only way for us to do this is to receive help from the community.
It's the only way we can keep our promise to provide the best care for families like Shelby's.
They've done a remarkable job of helping us through one of the worst situations of our lives. Children's is the best there is, in my opinion. There's nothing better. And they don't just take care of the child, they take care of the whole family.
We've already changed the lives of countless kids and families. And tomorrow, there will be new ones, looking to Children's for hope and healing.
She has her whole life to live. She's not at the end of life, she's at the beginning of life. And she is our future.